morning everyone. My name is Sasikala, anak perempuan Maren, and my student ID is 9310131057560001. Today I will be presenting my research proposal for Research Methodology and Scientific Communication course. The title of my research is Assessing Awareness and Knowledge of Tuberculosis Screening and its Impact on Job Performance and Well-being among Emergency Department staff at Hospital Selayang. For the introduction, let me start with the definition of tuberculosis. Tuberculosis caused by the bacterium named Mycobacterium tuberculosis. According to the WHO 2020, a major global health issue leading to millions of new infections and deaths annually. Primarily affect the lung but also can impact other parts of body. Tuberculosis is an airborne disease which spread through droplet. Healthcare workers are particularly vulnerable due to prolonged exposure in hospital setting. As we already go through the definition of tuberculosis and the higher risk for healthcare worker, now let me straightaway jump into the true incident which is inspired me to choose this topic for my research proposal. Tragic incident happened at Hospital Selayang, which is a staff nurse from the emergency department died in August 2024 after being diagnosed with tuberculosis. The incident highlights gaps in awareness and timely screening, underscoring the need for better tuberculosis education among healthcare staffs. Lack of sufficient knowledge, training and awareness about tuberculosis among the staff, especially at the emergency department, lead to delayed diagnosis and treatment. Therefore, it can contribute into stress, anxiety, and poor job performance. This research aims to assess the awareness and knowledge of tuberculosis screening among the emergency department at the Hospital Selayang. Problem statement. There is a significant gap in knowledge and awareness of tuberculosis screening protocol among emergency department staff at Hospital Selayang. Due to the frequent exposure to undiagnosed tuberculosis cases, ED personnel are at increased risk of delayed diagnosis and transmission of the disease. This risk was tragically underscored by the death of a staff nurse at the hospital, which highlights the severe consequence of insufficient knowledge about screening procedure. Without a proper training, staff may inadvertently contribute to TB transmission. Here, I had listed my research objective. First, to determine the current level of awareness and knowledge about tuberculosis screening protocol among emergency department staff at Hospital Selayang. Second, to explore how awareness impacts the quality of job performance in the emergency department. Third, to assess the potential effect of tuberculosis awareness on the personal well-being of healthcare staff. And lastly, to identify any gap in knowledge that could lead to improved training or protocol in future. So my research question is to understand what extent is the level of awareness of TB screening protocol among staff at Hospital Selayang. Second question about barrier in implementing tuberculosis screening protocol among the staff. And the third one, what extent does the level of training and education impact adherence to tuberculosis screening protocols? Okay, now for the research hypothesis. First, null hypothesis. The emergency department staff aware of tuberculosis screening protocol and there is no significant difference between the awareness and implementation of those protocols. Meanwhile, for alternative hypothesis establishment of an identified awareness of the tuberculosis screening protocol among staff, yet the implementation gap concerning the identified protocol is widely observed. Okay, now we move into the literature review. WHO 2020 had recommended routine tuberculosis screening for healthcare workers in high-risk environment, especially at emergency department. According to Sharma and Das, 2019, emergency department often prioritize acute care over tuberculosis screening, leading to misdiagnosis. According to Said et al. 2021, inadequate knowledge about TB symptom and screening protocol leads to delay in diagnosis and increased transmission risk. Bohim et al. 2020, Pang et al. 2020. Healthcare workers with insufficient training are less confident and less effective in infection control. According to Pang et al. 2020 and Sempao et al. 2021, lack of knowledge leads to increased stress, anxiety, burnout, and poor job performance. Improved knowledge and confidence in handling tuberculosis cases enhance job satisfaction and mental health. Pang et al. 2020. Anxiety about tuberculosis exposure can lead to absenteeism, reduce productivity, and compromise patient safety. By Said et al. 2021. Okay, now we step into the chapter 3 about the research methodology. For my research approach, I choose quantitative method. Cross-sectional study where data will be collected at a single point in time to assess the current level of knowledge and awareness. Stratified random sampling among staff nurse, medical assistant and doctor to ensure diversity across the staff role. For inclusive criteria between healthcare workers involved in direct patient care with at least 6 months of experience. Meanwhile, exclusive criteria is a staff with less than 6 months of experience. For data collection, questionnaire would be the best choice. Design is like multiple choice Likert scale question to measure the knowledge of tuberculosis symptoms, screening protocol, and awareness. Pre-testing will conducted on small group for clarity and reliability. Administration, both paper and electronic format for broader participation. Data analysis for quantitative, there is a two-type statistic, descriptive and inferential statistic. Descriptive statistic like frequency, percentage, mean, standard deviation to summarize the data. For ethical consideration, participants will fully inform about the study purpose, their right, including the confidential and the right to withdraw at any time, or et al. 2001. Significant contribution. Let's look into the contribution to new knowledge. This study will provide significant and specific insight into tuberculosis screening, awareness in high-risk, high-stress environment like emergency department, filling a gap in existing literature. Example, Yakub et al. 2020, Kahan et al. 2019. Identification of knowledge gaps. The study will uncover misunderstanding about tuberculosis transmission, risk factor or screening procedure which may impact staff ability to implement protocol effectively. Global relevance. According to WHO, NBHS1703, the study is particularly relevant in light of global concern about TB resurgence and the rise of drug-resistant strain. Finding may inform strategy to improve patient safety and reduce strain on healthcare workers. Applied value can enhance policy and training. Targeted intervention. The finding will help design targeted educational programs to address knowledge gaps, improving staff understanding of tuberculosis risk and importance of screening. Improved protocol. Those interventions will ensure better implementation of tuberculosis screening protocol, enabling early detection and reducing transmission risk. CDC 2020. Enhancement job performance and well-being improved by tuberculosis knowledge. Reducing healthcare associated infection by preventing of tuberculosis transmission. Patient and safe staff contributing to the safer hospital environment. There are positive impact on hospital management by improve the tuberculosis screening knowledge will be promote the culture of safety where staff are equipped to respond effectively on infectious disease. According to WHO 2023, the finding could contribute to the hospital accreditation process aligning with national and international infection control and healthcare worker safety standard. Okay, now I'm going to explain about my Gantt chart. In first 2 months, focus on gathering and reviewing existing literature related to tuberculosis screening, healthcare workers' knowledge and job performance impact. Second and third month, develop a structured survey based on the research objective. For the fourth and fifth month, administrate the survey to emergency department staff at hospitals Layang. The survey will be conducted by both paper and electronics. In 6th and 7th month, analyze the survey data using the descriptive statistics. In the final 2 months, focus on drafting, revising and finalizing the research report. Okay, now we almost at the end of my presentation. The question asked by my tutor, Mr. Selamat Yasin, is through your research, why do you feel that your study can contribute to improvement? Provide your justification. So here are several justifications for my research study which can lead into the improvement. First, enhanced awareness and knowledge. This study will help identify existing gap in knowledge and awareness regarding tuberculosis screening among the emergency department staff. By pinpointing those gaps, targeting educational intervention can be developed. Second, improving job performance. By understanding tuberculosis screening protocol and the importance of early detection, staff can enhance their infection control practice. This can lead to the safer working environment and reduce the risk of tuberculosis transmission among the staff and the patient. Impact on well-being. Increased knowledge about tuberculosis can reduce fear, anxiety among the staff regarding potential exposure, contribute to the better mental health and job satisfaction. Policy and protocol development. The findings through this study can be informed to the hospital administration and policymaker in developing or revising protocol related to TB screening ensured by evidence-based, boarded public health implication. By improving staff knowledge and practice, there is a potential ripple effect that can enhance community awareness about the TB screening, encouraging patients to seek care and reduce the stigma. Conclusion: this research not only aims to improve the immediate knowledge and practice of emergency department staff, but also potential to influence broader health outcomes. By addressing tuberculosis awareness and screening, this study can positively impact job performance, workplace safety, and overall employee well-being, ultimately leading to the better patient care and public health outcomes. Therefore, that is my research proposal presentation. Thank you.